Well, welcome to another exciting episode of the Crotchety Old Men Podcast. Hi, I'm Gary Smith, one of the co-hosts. Joining me today is George Plumley, our host. Top of the day to you, George.
Smitty, what's up? How you doing? As they say in Detroit, what up, doe?
What up, doe, baby? Man, it's all good here in this hood.
Definitely.
Sure. So what we got happening today, George?
Well, Smitty, it's I stumbled on some information. I was just like everybody else, you go to the doctor, you get a prescription, and then you go get that prescription filled, and they tell you how much it is, and all of a sudden, this particular time I got what called sticker shock. I used to paying, $8, $9, sometimes $3, and they were in the hundreds of dollars for this particular prescription, and I was really shocked, at the cost. I've heard of, different people paying those kind of fees for prescription drugs, but I've got insurance, and I thought that wouldn't affect me, one of those not me kind of a situation. So I thought it'd be a good subject today to talk about some of these pharmacies, talk about some of these drug prices, and even more importantly, I want to bring awareness to the ownership of some of these companies that are our providers for pharmaceutical drugs. Major insurance companies. You may not know it, but CVS Health Corp also owns Aetna. They bought Aetna back in 2017 for $70 billion. $70 billion back in 2000. And so, it's things like that. That's an eye opener for me. I'm going to CVS. I'm thinking they're, it's a retail outlet. They're selling things up front. They got prescriptions going in the back. But it's more than that. It's a conglomerate. It's interesting. I thought it was interesting. So I thought that's would be our topic for today.
Oh, absolutely. Great topic, man. But when you think about today's economy, not to mention our society, but in our economy, healthcare costs, everyone's aware of this, it just soared through the roof from pretty much all angles. And so now when you come to the area of pharmaceuticals, your prescription drugs and things of that nature, and the costs are just ridiculous and to treat many of the chronic diseases and stuff that exist today. And then we're talking about primarily our seniors. Well, I shouldn't say primarily because, heck, from the cradle almost to the grave, so to speak, drugs are administered to either cure and or treat, and primarily treat certain diseases and stuff. But hey, let's talk about, all right, first of all, you hear pharmacy benefit managers in the industry, the abbreviation for that is PBMs, right? And so let's kind of open up, what are PBMs? Okay, what are they and who are they and what do they do to us? I'll answer the first one, George, and then we can take it on from there. PBMs are the middleman, actually, in the prescription drug supply chain. What they do is that they negotiate between the drug manufacturers and the pharmacies and the health insurers. And what they do is they negotiate pricing. The three largest PBMs, like you were alluding to earlier, George, are CVS, Caremark, Express Scripts, Cigna, you got United Health, and they control about 80% of the market. Originally, PBMs were created in the 60s, what have you, and they evolved to these powerful entities now that, hey, they influence the audience with, they influence the whole marketplace. So they're
yeah, and that's the part that concerns me, Smitty, is the fact that they're owning 80% of the market. We're here as consumers. We think we're going in and getting discount coupons when actually we're dealing with the same company. It's interesting. Again, the list goes on. It required Aetna. They've got Caremark, which is a major pharmacy benefit manager. Oak Street Health, which is a primary care center acquired in 2023. Omnicare specialization, Minute Clinic, long drugs, which is a retail outlet. I mean, the list goes on. I mean, here we are, we're thinking, one of these is competition across the street, but you're dealing with the same company. It's hard for the consumer to win in these kind of situations because of the fact that, like you said, not only are they owning the drug, they're basically pricing the drug. They're owning the healthcare facilities. The list just goes on. I mean, it's hard for us to win in a situation like this. And then they've got partnerships with Cardia Health and Target, CVS. Target, CVS acquired. You go into a Target. Let me say it like this: they have a pharmacy. Well, that pharmacy is owned by CVS. So here again, you think you're going to Target, but you're actually still going to CVS. So it's I don't know. I think here again, it was an eye opener for me, and I'm sure for others out there that, here again, we think we're going somewhere else to get a better price, but actually you're dealing with the same people over and over again.
Yeah. The problem is that there's no transparency.
No.
You see, and then you couple that, and then we go to this next phase. All right. The out-of-pocket costs that these PBMs, are putting on us as consumers. I mean, many patients, they pay the co-pays based upon a drug list, not the lower negotiated price that the PBMs negotiate. That's not a part of it. They pay the co-pays based upon the price of the drug that's listed from the pharmaceutical manufacturer. Now, that questions whether PBMs prioritize payment based on rebate size versus clinical effectiveness. And who pays for that?
Mm-hmm.
The patient. Because it doesn't necessarily mean that you're getting a better drug or a better drug or whatever based on price. But because there's a lack of transparency and stuff, and that spread, as we call it, arbitrage, however you want to label it, the PBMs walk away and they're going to the bank. And when we talk about going to the bank, they are making a ton of money.
Oh, yeah. I mean, it's a lose-lose for the consumer. I mean, even when you start, interjecting generics in the situation, in most cases, the how here again, the CVSs of the world own the particular drug. They have a patent on the particular drug for a certain time frame. So that means you can't get it anywhere. You can get it somewhere else, but you can't get it for a lower price because they're going to set the price. Then they come out with a generic after the patent expires, and then they own the generic too.
And man,
it's a no-win situation.
Yeah. And then, it puts a lot of pressure on your independent pharmacy. I remember growing up, man, we used to have pharmacy in the neighborhood. There was no CVS, Walgreens, Rite Aid, and that kind of jive. I mean, they may have been around. Take that back. Walgreens have always been around for as long as I can remember. But my point being is that, you had your local pharmacists. All right. There was pharmacist careers where, people going to college, coming back, their parents had a pharmacy. And so, you go to school and study pharmacy, and then you come back and run that business. Well, in today, most independent pharmacies have closed, citing that the unsustainable reimbursement from PBMs is just not sustainable enough for them to, to stay in business. So this thing hurts from more than just our pocket. It's decimating things in our community where we're, to your point, we're pretty much forced to go to these big conglomerates and pay through the nose for prescriptions.
Yeah, I mean, just like it's funny you just mentioned Rite Aid. I mean, CVS has basically acquired select assets in Rite Aid.
Oh,
so here again, I mean, it's unbelievable. I mean, as they say, the tentacles, are far-reaching, whereas they may label it something else, but it's still the same company. It's still going in the same pocket, still going in the same wallet, and that's just CVS. And like you say, their competition. Okay, here again, United Health Group. They own Optimum Health, Optimum RX, United Healthcare, which is the insurance company. So if the insurance company and the pharmacy and the doctors and the care centers are all in the same boat, You got the doctor saying you need this drug. Well, you're going to go down the street to my pharmacy and pick the same drug. We're going to charge you extra for this, but this is the one you got to have.
Now, looking at it from the PBM industry position, obviously, there's two sides to every coin or every story. So now their position is that they're saving the healthcare system billions of dollars by negotiating lower drug prices. I'm not sure about that because the consumer doesn't see that. Like we said earlier, we're not getting any of the rebates and lower costs than that. Yeah, they may be negotiating with the manufacturers or the pharmaceutical manufacturers, but the savings doesn't go to the consumer.
No.
The competition among the PBMs themselves, just like we're talking about the competition among drugstores, I mean, they're almost like cannibalizing themselves because it was Walgreens, I believe, or CVS, like you said, they bought out Rite Aid, and then you got other ones snapping those up. But in addition to that, man, you're talking about the services and the utilization and preventing waste. They're compounding the problem, if you will, is what I'm trying to say. And that lack of transparency almost makes it impossible to verify any savings. Where are the savings at?
Right. I mean, there are no savings because, like you said, because it's all intertwined together. Here again, major acquisitions and subsidiaries of United Healthcare, SCA Health, which is a surgical care facility. Surgical care. Okay. Yeah. Change Healthcare is a technology and data company. I mean, they own that. The Vita Medical Group. It's a physicians group. So I'll go on. I mean, Landmark Health Homes based medical care, home care. I mean, it just goes on and on. So, and then they have their partners are here again, Walgreens, Walmart, CVS, Kroger, Publix, Family Dollar, Dollar General. So, you think from a consumer perspective, well, heck, you ask somebody, so where do you get your prescription? Oh, I go to Publix and I get a cheaper price. Well, hell, they're owned by the same company. You're not getting a cheaper price.
Cheaper price.
It's like, it's just like I said, this was a real eye opener for me because I never thought that these pharmacies were that, far reaching as far as ownership, and it's amazing how the medical industry has kind of been intertwined together. It's a good thing that you can go into your doctor, say, for example, if you go to emergency and you go to a particular hospital, then when you go back to your regular doctor, they can access your records and see what kind of treatments. Now, that's a good thing.
Mm-hmm, mm-hmm.
But if they're controlling all the costs, what's really the difference? Where's my choice?
Oh, go ahead. I'm sorry.
No, go ahead. I think when, and we're old enough to remember and understand when you actually did have a choice, when all of these companies weren't mixed together, but, they brought it out to the consumer that if we pull all these together, like you say, we'll be able to give you a better margins, better costs. But that's not really the case.
Mm.
No.
Not at all, and then, patients are often caught in the middle on facing these high costs despite the negotiated discounts and stuff that we've been talking about. But here's another kicker, George. You got this pre-authorization requirement.
Oh, yeah.
Man, that's crazy. It creates a barrier to accessing the needed medications that you have. But now you got to get someone else's opinion, to get pre-authorization to get the doggone drug. And like you're saying, all right, go to Publix or whatever, but hey, it's still my company, so you still paying me either way to go. It's just it's crazy. These formularies, the formulary drug versus generic drugs, they force a patient who may have lesser means to possibly choose a less effective alternative. And that in and of itself just exasperates, just multiplies the problem, because now you have some people who, they can't afford a 30-day supply of, let's say, blood thinner or what is it, high blood pressure medicine. So they'll get 10 tablets or what have you, or 15, or whatever that they can afford at the time. And so now here you have an irregular regimen of treating a chronic disease. And I just pick high blood pressure for one, but there's a million other probably diseases, whatever that's out there, ailments, let's call them. And so now the public's health is put into, I'll just go ahead and say, a dangerous predicament where you have to decide between, in some cases, this is real true in some people's lives, that they have to make a decision between food and a prescription. Mm-hmm. That's where we come to in America as it relates to healthcare. And that, my friend, is ridiculous.
Yeah. I mean, we really think, we're controlling different things in our life, but as day by day goes on, we're losing control. It's just the opposite. We're losing. I mean, you can go to which I use sometimes, a health broker to try to get the cheapest cost, when it comes up to time to renew your insurance for different things. You can go to a broker and they're going to give you the best price. Well, they're basically telling you that, well, if you get this particular insurance for your pharmaceutical drugs, then they want to classify the drugs. They're ABC type drugs. So if you take this, it's this price. You take B is this price, and C you take this price. So here again, I'm good if the only pill I have to take is in classification A, because I know I'm going to pay X amount. But if something happens during the year and then I'm kicked to a C drug, then all of a sudden, boom. And then I'm locked in for a year, so I can't go back and change, because you want to you have to keep your plan for over a year. So here again, if something changes with your health, your insurance is not flexible enough to change along with it.
Well, fortunately, I guess there might be a little light at the end of the tunnel in that on a state level, there's some reforms that's happening where many states now are passing laws that require these PBMs to be more transparent, number one. I noticed the CMS, they have made some reforms to Medicare Part D that affects some of these direct fees and patient costs. But then again, then also now, not sure how factual, and I shouldn't say how factual, it's factual, but I don't have any detailed examples to share today, but there are some pharmacy groups that are suing these PBMs over their reimbursement practices. Now, that may be a kick the can down the road type of action or whatever, but as an advocacy, we need something or someone, an institution of some sort, whether it's on the federal level or the state level, to address this, because it's just totally has gotten out of hand. And I just kind of like rhetorically asked the question, if PBMs were eliminated tomorrow, what would happen to drug prices? Think about that. Drug prices would drop like a rock.
Well, that's what I'm thinking too, because there's so much added to it, from a layer and management perspective that, they're controlling these prices. But, and you've heard about, people like Mark Cuban and some other folks come in, they're going to sell certain drugs, for a lower cost, and you wonder how they do it. But now that, I'm seeing how all these other CVSs are linked together, it's probably worth investigating to see, because, if they're able to get the same drugs at a lower cost, I mean, at the end of the day, from a consumer perspective, that's what we want. Lower costs, that's what we were promised.
Well, there's some indication where some generic drug pricing, there's instances where, shucks, if a patient paid out of cash without using the insurance, it's cheaper than if they went to the drugstore.
Yeah, because they've got a thing down here called Good RX. And you can say, well, they can say, well, you got, whoever your carrier is, but if you go use this, and which doesn't cost it, it's just a little card, you use Good RX pricing, it's cheaper. And you wonder, how do they do that? It's the same drug, it's outside of your insurance that you're paying for every month, but then it's cheaper. But these are kind of things here again, an eye opener. You need to use it because everybody doesn't know about that.
Right.
Yeah.
And then to force you to go to one of these big conglomerates, man. Again, I'm kind of harping on that, and then not have your choice. You're taking away choices here, okay? And these choices are pretty, quite frankly, life-threatening choices.
Oh yeah.
You know what I'm saying? Shucks. You're not just taking these drugs. We're not talking recreational drugs.
Exactly.
These drugs.
Yeah, I mean, they're supposed to give you light. Help you. Being able to function every day in your world. Yeah, I mean, but like you said, let's talk about some solutions. From a consumer perspective, and you've heard me talk before about the importance of getting involved in the political process. But here again, this is something that we need to take seriously, because even though it doesn't affect us today, just like I explained my situation earlier, it could affect you tomorrow, because something could change, drastically with your health. Now you're required to take an additional pill, which is going to, engage in your budget. I mean, medical is insurance is very, very expensive itself. And then you're going to layer on the cost of additional prescriptions, from a retirement perspective, that could, definitely put a hold on, your lifestyle. But like you say, it's something you have to do, to maintain your life. But yeah, I mean, the political process, making sure that we're getting a little bit more engaged and educated on how this works, and how healthcare works. It's not just a matter of, when we're working, they give us 3 selections. We push it's either a PMO or HMO, and you select which one you want, and you go about your daily process. But now that we're retired, that's something that we have to look at a little bit more closer to make sure that it's really fitting our needs, and that we're not paying out of the nose, through drugs that we could getting somewhere, less expensive.
Man, the complexity of this whole system makes it very difficult, for the average consumer to understand. So I guess the ultimate question, George, becomes, how do we create a system that truly prioritizes patient access and affordability? I mean, that's the bottom line. How do we do that? And of course, I know you mentioned, not from the political side of it. Yeah, we do have to get involved, hold our Congress people or representatives, state representatives. We can only start where we can start. So let's start here right on the local level in the state, city, wherever it is that you live in. Start with this at the state level, is to hold them accountable, write them letters, complain. What's the old saying? The squeaky wheel gets the oil. If there's enough, you look at, I take the state of Michigan, for instance. I don't know how many millions, it could be 12, 18 million people who live in the state of Michigan, probably off. But of that percentage, there's a higher percentage of people who are using prescription drugs for whatever reasons, and nowadays, heck, you got a lot of kids that need drugs almost as much, if not more, than some of these seniors. So there's gotta be a solution to this, and I'm just flat out gonna call it what it is, this highway robbery of people having to spend, and especially those, I feel really compassion for those people who are on a fixed income, man, and whose retirement was not planned around $1,000 a month. And I'm probably being very modest here with this figure. $1,000 a month. Can you imagine? Stop paying $1,000 a doggone month to stay alive.
Well, yeah, and that's what it comes down to. I mean, if you go, like I say, if your health changes, and you're treated, and they prescribe a certain drug, and you go to the pharmacy to get it filled, I mean, it was like, she said $2.39, and I'm thinking $2.39. She said, no, 200. I'm like, what? A month for a 30-day supply? You multiply that times 12.
Oh, baby.
So, here again, advocacy, for that's because when we vote for anybody as far as its representation.
Mhm.
But then we have to go a little bit further to get somebody that's going to advocate for us for the things that we feel are important. You look at the news every day and they're going to tell you what's important. But we as individuals and as groups, I mean, there's strength in numbers. When you talk about fixed income, and we're retired, we're on fixed income, so we've got to, see what's really important to us before it affects us. When they start talking about drug prices, because it's not affecting us today, because, we're able to exercise and do the things that we need to do, it could affect us tomorrow.
That's right.
So, yeah, I mean, this is something to me, like I said, this was a real eye opener for me. And I hope for others that are listening to this podcast, kind of get the importance of understanding how these large corporations work and how they're all intertwined together and how they're controlling, prices in an area that, are very critical, like you say, to our everyday need. You hear it on the news, and they're gonna change this requirement and that requirement regarding CDC has done this and CDC, and we say, oh, well, it doesn't really affect it. Well, yeah, it does. It does, because it's going to control the price. And you can relate this to any other thing that you want, from grocery prices to gas prices to everything else. I mean, they're all so intertwined together that unless you do the research behind it, you don't really understand how it's impacting your life on a day-to-day basis.
Absolutely. Silence is acceptance. Make your voice heard.
Yeah, exactly. Silence is accepted. And that's how, that's the position they put us in until it impacts us. Because we always, had that attitude where, well, it's not me, it's them. Well, you could be them.
That's right. In the blink of an eye, literally, you could be them. All right. Well, I want to encourage everybody that's listening, man, that, check your pharmacy benefit details. And so to the point where you can understand their formulary, understand what goes into it. Do your homework, do some research. Whatever medicine that you may be prescribed to take, obviously we're not giving any advice for them to take it and not take it or switch it and all that, but certainly do your research on that particular medicine. We have the tools, you've heard us say it before here on the episode, on the show about, AI. Put that medicine and that name in there and find out what alternatives, what generic drugs that may be available. Certainly you can ask your physicians or whatever, but gather as much data as you can. Educate yourself on the medicine that you're taking. And then, of course, you can take it a step further. Maybe identify some alternative ways by way that maybe you can minimize or reduce the amount of dosage that you're taking. All right, which that reduction in dosage will also be a reduction in pricing, okay, in terms of money that you spend. So, there's all kind of ways and things to do things, but I think more importantly, too, is that to write those letters, send them to those Congress people, Congress and representatives, because you're voting for them, and then on the federal level, shucks, again, something has to be done, and something can be done, but we have to express our feelings and thoughts about the situation. Otherwise, it's just going to keep going up, 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 and up, and up.
Yeah, I mean, that's the whole thing is as these people that we vote for, your representatives, they're accessible, and you have to make your voice heard. You either, like you said, write letters, pick up the phone and call, when they have these different forums where they appear, ask questions, because the way the system is supposed to work is they're supposed to act based on how we want them to act. What, like you said, what are the hot topics? What in my district are my people most concerned about? And these are the things we have to make them heard, and not just sit back and listen and let them tell us what they think is important. Because, at the end of the day, yeah, I know all this stuff that we hear on the news is important, but here again, it's about what's hitting our pocket and what's affecting our life and lifestyle on a day-to-day basis. So we have to make our voice heard and get out there and, like I said, and talk to them and see if we can influence, some of these decisions and what are some of the hot topics.
Amen. Amen. Well, as we wrap up this episode today, in the words of our former president Barack Obama, yes, we can. We can make a difference. So here's a word for the day, if you will. I won't call it a quote, but I think somebody did quote this. Harry Brown, I think he's a professor at one of those smart universities. Everything you want in life has a price connected to it. There's a price to pay if you want to make things better, and there's a price to pay just for leaving things as they are. There's a price for everything. Consider the price. Okay?
Well said. And as we always say on the Crotchety Old Man podcast, if you didn't know,
now you know.
All right, take care. Be blessed.